pressure, diabetes. 99 plus lady also have the cancer, kidney problems, third stage of kidney disease, rheumatoid arthritis, and 2 types of cancers, breast cancer and skin cancer, gout. Alzheimer and dementia both not come straight away. People are suffering from that one. Before that one, they have lot of symptoms, but if people keep their lifestyle healthy, they can prevent it. They can save from Alzheimer and dementia. Problem is, nowadays, lot of people are suffering from main cause of these genetically, blood pressure, diabetes, some kind of injury on the brain. Also, you can get from that problem. But all these main issues, depression, anxiety, when we taking a lot of medication, a lot of side effects of the medication, that is also become the brain issue. Other biggest issue, according to Ayurveda, what I found in these patients, which one is, they are both are reversed. They both was start speaking again. Both was remember their life. Because in foreign country, our people know the Ayurveda very well, but because medicines, treatments are free, they don't want to come to private. But what the patients came, we got the 100% result of that one from the Ayurveda. Ayurveda can save people on that stage, what I say, that is called last stage, when they lost completely memory, lost completely contact with anybody, lost their all the muscles in the mouth, they even can't eat. After the treatment, they start eating. They start drinking their own, they start using their own hands. We talk about the Ayurveda. Every therapy doing their best. We can't say only Ayurveda is doing. Doesn't matter, any country, people are suffering. If dementia, these reason, if they have them in the family, diabetes, blood pressure, and memory loss, anxiety, many people have that genetically anxiety. They are very quickly become upset. This also in the genes I see. And fourth one, biggest issue, I say gut problems. Gut problem is anything related to gut disease. They are because gut and brain, in my experience, in my research, in my treatment, I found they both people have the very bad appetite, very bad gut problems. When I done that one, first I look after their gut issues. Many type of gut issues, we all know, we don't need to go very far, that one more detail. Every doctor we listening, they know what kind of gut issue. Because the gut and brain are very much related to each other. When gut is not healthy, then liver is not healthy. If liver is not healthy, our blood is not healthy. Simple theory. Ayurveda is I do only Ayurveda. I talk about only Ayurveda. What I found, Ayurveda is so easy to understand, so easy to do the treatments. If we know the proper Ayurveda, if we know our body system, how they're working, which one is related, so many times I mentioned, our organs, if we know how they work, Ayurveda, any doctor, any Ayurveda Vedya can manage that one. But if they start thinking where we can get the Alzheimer medicine, where we can get the dementia medicine, where can anxiety medication, no. That way, I don't think so. All people are trying to do it. In my experience, you gave me a lot of respect. You introduced me to the world for especially my program 1 hour. I'm really thankful to you. What was my research is, as I told you, the list of what I done. I again say to every Ayurveda practitioner, we have the 10 major organs. Just find out they are related to very much each other. If they know how they work together, then they can do it. I'm not saying if brain is toxified, definitely toxified, because all blood, if the pure blood is not there in your body, if blood have some problem, when they reach to the brain, blood's work, it's not only job to give the oxygen, blood do the 2 jobs. Reach there, give the oxygen, and take the toxin from there. That is, if blood have lot of toxin in the blood is not purified, we call, then
Right.
all the toxin there, leave it there. Slowly, that protein, when they go to the brain have more water than the body. Then that area become toxified more. That protein made the plaque there. In the small veins, very small, millions of brain, in brain we have that one. They control all our major glands who giving us the sensations, giving us the messages, giving us the memories, looking after our memory, looking after our, all the order coming from the brain. And then those are not connecting each other, not make the link each other, becoming slow. That is in dementia and Alzheimer. The sign, when they start the signing, something missing, something losing, something can't remember anything. That's mean not they start that time. Already brain is, that is the first stage, I say, when you forgetting again and again, then it's mean you are going to the dementia side. You have to be, when you take that sign, immediately you have to take the action on that one.
Right.
Not go to the any home remedies. You have to check your brain. They have the lot of MRI. They can check the front lobe, side lobes, or back lobe, how much they can damage that one. According to science, they're saying their cells are dead, not working anymore. On that one, as a researcher, I don't think so that is the right answer for that one.
Very rightly introduced, sir, the disease. If you kindly permit me, can I present 3 or 4 slides for your valuable blessings? General, for our YouTube viewers, they want to know that what is the actual disease, and on disease we will focus.
Okay, thank you very much.
Support
Do
you.
it, but
we will discuss in our next this after 5 minutes, because
okay, that's good.
your valuable blessings will be more. So
Yeah.
generally, modern philosophy is considering this, that this has been introduced in modern era. Otherwise, it is absolutely mentioned in our Sanhita Kal also.
Yeah.
Dr. ALZHEIMER, German physician, he was in 1906, he described this Alzheimer's. So we are pronouncing it as Alzheimer's disease. Otherwise, it is mentioned in our Samhita and text as Smriti Bhrans, Smriti Nash and Smriti Bhrans. But due to this Lord Macaulay's theory, and it is being considered that everything is developed in foreign only. So it is a chronic irreversible disease that affects the cell of the brain and causes impairment of intellectual functioning, as you told us clearly, sir. Really, your valuable blessings are excellent, sir. It is a brain disorder which gradually destroys the ability to reason, remember, imagine, and learn. Everything. No reasoning, no remembering, no imagining, and no learning. This is the photo of brain affected from Alzheimer right and normal aged brain in left. So you can see the difference, hollowness, empty, severely and means entrapped ventricles. So the difference is there, atrophy is there, impairment is there. So these are observed in Alzheimer patient. About 3% of men and women ages 65 to 74 have Alzheimer disease. 3%, according to the WHO statistics. And nearly half of those 85 and older may have the disease. So that means that is very serious issue. And according to your good self, this is due to our toxic brain. You are very right, sir. And Rakta Dushti is the main cause of this, and gut and brain system is also there. About 360,000 new cases of Alzheimer's are diagnosed each year.
True.
Cause is not known, but absolutely cause is over-exertion, over mental exertion, no physical exertion. Unwantedly worriedness, चिंताएं बहुत करता है आदमी. ये न्यूरोकेमिकल फैक्टर्स में यदि हम बात कर लें, एसिटाइल कोलाइन, सोमेटोस्टेटिन, substance P, norepinephrine, all are responsible for this impairment. Environmental factors, cigarette smoking, certain infections, metal, industrials, or other toxins. Means everywhere toxins are there, sir, as you guided us. Definitely toxins. Use of cholesterol lowering drugs, statin. This is also important fact. So if we are taking cholesterol lowering drugs, we should use to our patients Medhya Rasayan, Brahmi Grat, Saraswata rest, whatever your doctor advises you, but we should start taking Medhya Rasayan of Ayurveda if we are taking cholesterol medicine. Genetic and immunological factors are also there. Definitely ApoE4, LDL receptor, angiotensin, these are all related with this. What are the risk factors? Down syndrome, family history, chronic high BP, head injury, gender, smoking and drinking. These are the risk factors for Alzheimer's disease. And it attacks nerves and brain cells as well as neurotransmitters. It attacks all of three: nerves, brain, and neurotransmitters. So the destruction of these parts causes clumps of protein to form around the brain cells. These clumps are known as plaques and bundles. So these plaques and bundles disturb the brain, and ultimately Alzheimer comes. The presence of plaques and bundles start to destroy more connections between the brain cells, which make the condition worse. So I'm not going to detail, but I would like to have your valuable blessing on these topics. This is normal, and these are amyloid plaques between the nerve cells. So we can observe in this photo well that what is the pathophysiology of this. Cause is unknown, but pathophysiology is definitely known. by the science. Enzyme APP, enzyme acts on the APP, amyloid persicore protein, and cut into fragments. The beta amyloid fragment is crucial in the formation of senile plaques in this older disease. Just see the change of protein, sir. These protein changes are there, and as you are guiding, we will discuss on these signs of warning signs, 10 warning signs. Modern science has clearly mentioned 10 warning signs: memory loss, difficulty to performing familiar tasks, problem with language, disorientation to time and place, poor or decreased judgment, problems with abstract thinking, misplacing things, changes in mood or behavior, changes in personality, and loss of initiative. So now we would like to discuss on science, sir. What are your valuable guidance on the science of Alzheimer's? Then we will.
Thank you.
Yes, sir.
Thank you very much. You explained very nicely. I no need to explain that. That is perfectly in the science, in the researches, they say this one. But these signs, when already people have suffering from the Alzheimer and dementia, if we go that stage need the very, very professional people who can do the treatment. On that stage, not easy to cure that one with any home remedies. Those time, they're not only nervous system in the brain, whole body becomes the problem, that one. And all the, especially in the area of the mouth and lungs, they can't do anything themselves. These are the great symptom when people are suffering from Alzheimer's. Second, when they reach the second stage, then you need the proper treatment. Proper treatment, what I done, I can say. How I reverse their Alzheimer's, and that is the most important. As I mentioned many times, in our body, anything in our body, we need the detoxification. I done the same detoxification, which we call the Saptkarma, full body detoxification, because reach to the brain to detoxify it, only you have to make the blood purify and healthy blood. Healthy hamara is our healthy organ, main organ is liver. And protect and cure the gut problems first. If any Ayurveda practitioner try to do that one, this is my program for them. What I am doing, I'm sharing with them. If they want to treat Alzheimer or dementia patient, first they have to check their gut problems. What kind of the gut problems? They look after that area. With anybody have the gut problem, they definitely have the liver problem. Many other things, every Ayurveda Vaidya, they know what kind of other things. No need to go so much detail. Look after the gut area, do the blood purification, look after the liver. When the blood is purified blood, when they reach to the brain, they definitely go to the brain, circulate everywhere. Then blood, purify blood, they have no any toxin in the blood. Then they start removing that plaques. Start removing from their toxin, and they slowly become the brain area without plaque. As soon as that plaque is removed from there, give the other medication. We have so many medication for the brain. We have the Brahmibati, we have the other area, we have the, if they're not sleeping properly, give the Shankh-Pushpi or give the Tagar. These are we can give to them. But only they work. They not work until you not cure these things first. These three is main source of the remove the dementia patient any problem from there. As soon as your gut is healthy, liver is healthy, automatically blood is healthy. And also give some kind of the blood purification medication definitely in the beginning. They take maybe 1 or 2 months. My patients, I got the experience, I'm sharing with my experience. Within 2 months, their muscles start working. They start eating themselves. They start little bit holding. Most of them, they do the poo and pee inside. They don't know how to go to toilet. They don't know how to go to the pass the urine. They always do inside. After that one first day, because the blood's purifying, the kidneys start working, functioning properly, and they start remembering later they want to go poo. Within 2 months, as I told you, 2 major case they came to me, not come more people, because the people don't want to the private treatment in the in countries. But this was as a Ayurveda researcher I designed, and I'm telling you, if somebody do, we can. I offer these kind of things as the Ayush Ministry before. I can offer this all things to everywhere. We can teach this thing to everyone. If the more patients come, we can do the more data on that one. These 3 things, any Ayurveda practitioner, if they want to do it, I'm happy to work all together if the case come. But 3 area you have to 3 organ is very important. If they have with the anxiety or other thing, those time they don't know what is the anxiety. 4th one is big problem is blood pressure. Doesn't matter Alzheimer patient, dementia patient, how bad, they still have the blood pressure. They still have the diabetes problem, type 2 diabetes. Control these things. These 5 things when you start controlling, and slowly, one of my patients have the type 2 diabetes from 25 years. One blood pressure, other one don't have the type 2 diabetes, but he have the arthritis. With the arthritis, they're taking a lot of painkiller. Painkiller damage the liver. So liver damage through the painkiller, you have to do the different kind of medication. Painkiller, diabetes make the liver damage, pancreas damage, agnacia damage, have the different kind of medication. Ayurveda is the same protocol make to the design the formulation, design the medication. But 5 these problem make the most dementia people. Some have that genetically, no doubt. But all they also have these problems. Control the blood pressure. Blood pressure is not only one type of the blood pressure to everybody. If the Pitta Prakriti is different, if they have other medication, the reason of the blood pressure is different medication. So these case to be studied, case to be discussed. Not just like we can't follow the like other therapies. Oh, this is medication made from the pharmacy, and you have to provide that one. Ayurveda is not like a first state of chemist. We have to be work like a Ayurveda practitioner, Vaidya. What Vaidya? If they know the job, he know what is the reason of the dementia. Then we can reverse this one. These are reversible. And we have the video. If I know you want to, I can send you the video. I can't send you now. Okay, I can. I have the video. They start walking. They start remember that 99 plus year lady. She remember everything when she born. How many children they after 15 years reverse. And other person is Indian. He wrote me nearly 12, 13 A4 size page of the translate of the Gita.
Right, sir.
So these are
If you kindly
curable.
permit, sir, now in next session, please allow me to share 10 slides of Ayurveda, progression in Ayurveda. Then we will discuss on the treatment, what treatment we can prescribe or we can suggest. No doubt it is not the disease which can be treated through home remedies, but prevention can be done. Definitely you are right, sir. So
Yeah,
please allow
prevention.
me.
Thank you very much. Prevention is eat the good food, do some medications.
We will be discussing after this presentation, sir, if kindly
Okay.
permitted.
Okay, no problem.
So symptoms of Alzheimer's are memory loss, changes in memory. And this is not being done in one day, sir. 10 years,
No.
15 years, progressive disease is there. Forgetting words or substituting inappropriate words. This is also the symptom of
Yeah.
Alzheimer's. Problems in speaking, reading, writing, and understanding, as you told. She means they are not aware of their excretions also. Disorientation to time and place, poor or decreased judgment, problems with abstract thinking, they can't think abstract, they can't summarize something, misplacing things in inappropriate places, drastic changes in personality, difficulty performing familiar task, routine task. So these are the symptoms, and this disease is progressive.
Even
Mild
even
cognitive
they
impairment is duration 7 years.
uh,
But
even even they stop recognizing their family members.
right, sir. Very right, sir.
Even they stop recognizing their own children.
Yes. Yes, that is
What
the severe
I
Alzheimer.
experience, they don't know who you are.
Yes.
This is the last stages, I say. And also they
Severe
don't,
Alzheimer.
as I mentioned, they don't know when they got poo, they got in the trouser, they got urine, they pass there. This is the stage, is last stage. Both patients come to that stage to me.
Right, sir. Right, sir. So Alzheimer has 4 stages. Pre-dementia, where Ayurveda works excellently. Pre-dementia.
Excellently, no doubt this one. After first patient, when I done here, and I tell the some people joke on me,
No.
Ayurveda practitioners.
Let them
And
joke.
then when I second done, then they say yes, it can be cured, that one. So we have to be discussion first, then doubt on anybody. We all are qualified, we all are expert with that one. We need to be more little work, we can
Right, sir.
save the world.
So for YouTube viewers, I'm presenting this because on demand of YouTube viewers. Prodromal symptom pre-dementia, that is for 7 years. If person is not having focus on his habits, his or her habits, definitely next stage comes early stage, mild Alzheimer's.
Yeah,
Middle stage, moderate Alzheimer. Mild
moderate, then
Alzheimer
great.
for 2 years, moderate Alzheimer for 2 years, and then severe Alzheimer 3
Yeah.
years. Means these are the stages. Different symptoms are there. Mild symptom to moderate symptom, missing, not remembering, forget names of family. This is early stage. Greater difficulty remembering recently learned information, that is middle stage.
uh,
Deepening confusion in many circumstances, problems with sleep, trouble knowing where they are. In later stage, severe Alzheimer's, poor ability to think, problem in speaking, repeat same conversations, more abusive, anxious, or paranoid. In
I,
diagnosis, if we tell to
I add one thing. I add one thing more. Severe condition. Both patient, what I experience, they even not speak.
very right.
They completely speechless because they can't speak. Their mouth muscles are all the saliva is coming. That they say both patient, which one, thanks to Ayurveda, I proud I am Ayurveda practitioner, Vaidya, and God choose me for this one. And I can't say thanks to the Dharmantri ji, thanks to our Acharya who designed the Ayurveda in the books, that one, and thanks to my Guru.
Right, sir. Right, sir.
Who taught me how to find out the diseases, which way I learn in
You are
Gurukul.
experienced, sir. You are
So
much
this is the way we can do it, that one. Any kind of the disease they say.
That's what I am communicating, sir, according to modern science. So for diagnosis, detailed history is necessary, examination is necessary. 8 cognitive domains are there: memory, language, perceptual skills, attention, constructive abilities, orientation, problem solving, functional ability. On these 8 cognitive domains, we have to examine the patient before starting the treatment. Neuropsychological test, mini mental state examination is there. So pro forma is there. Some exercises are there, so we can identify whether patient is suffering from Alzheimer and on which stage. Investigation, MRI, PET scan. So this is at the severe stage. In Ayurveda, if I say no direct reference for Alzheimer, because Alzheimer name was not known to our Acharya. On the basis of its clinical presentation, it can be correlated with different entities.
This was not that time Alzheimer kind of things.
Single Ayurvedic correlation.
These are new gift of the toxified things from the world from last 50 years.
It was there. Pranavrata Vyana symptoms are there. Charakastan, Sarvendriyanam Sunyatvam, Gyatva Smriti Valakshayam, Vyane Prana Prate Lingam, Karma Tatrordha Jatrukam. So that means this again involvement of Manodosha is also in Charak Nidan that is there. Unmadam Punha Mano Buddhi Sangya Jnana Smriti Bhakti Shil Chestachar Vibramam Vidyat Charak Nidan 7. So discriminative knowledge, buddhi uhapo havati, smriti atitarth vichayar gyan, sangya namo lekhyan gyan means it was described as in our Charak and Bhagavad Gita also. Smriti Bhransh.
Smriti Bhransh.
One definition is that. Tattva gyane smriti yasya rajo moha vrtatmana Prachade yat yatsa smriti vransa smritam vyam hi smrito statam charak sharir, first chapter. So means smriti vrans is already there where mental exertion is much more in comparison to physical exertion, and a person is suffering from high BP. Like this in Gita also, sir. They ध्यायते विषयान पुंसा संगस्ते पुष्पूजायते संगात संजायते कामः कामात् क्रोधो अभिजायते क्रोधात् भवति सम्मोह सम्मोहात् स्मृति विभ्रमा स्मृति भ्रंशात् बुद्धिनाशो बुद्धिनाशात् प्रणश्यति means Gita has also described this as our smriti bhrans, smriti vibram and buddhinash. Clear progressive pathogenesis. There in Gita it is written first Sammoh, then Smriti Vibram, then Smriti Bhransh, and then Buddhinash. This is mentioned in our Bhagavad Gita. So I am not going into Samprapti Ghatak dosh is the Mansik dosh, Vata dosh, Tusya Manas, Agni Jatragni, Srotas Manovaha, Srotodoshti Sang, and Adhistan is Man. Chikitsa. Abhigat Chikitsa number 1. Snehapan, Brahmi Grat is there, Rasayan Grat is there. So many Kumar Kalyan Grat, so many Grat is there. Shodhan Chikitsa, Rasayan Prayog, Medya Rasayan, Sattva Vajay Chikitsa. These are the treatment mentioned in our Ayurveda for this disease particularly. I am not going to detail. Shodhani is there, Kalyanak Grat, Mahakalyanak Grat. Just use these after advising your doctors, but this is being recited for your confidence, YouTube viewers, that we Ayurveda has remedies for this. Brahmi Grat,
Definitely.
Panchagravya Grat, Mahapesachik Grat, Puran Grat. Woman and Virechan, age to be considered between 7 to 70 years. Nasya of Brahmi Grat, Jyotishmati Tel, Anu Tel, Shadbindu Tel. Vasti, Yapana Vasti, Mustadi Yapana Vasti, Raja Yapana Vasti, Kheer Vasti, Guduchi, Matra Vasti for prevention. Vaipurmanjan, Abhyang, Chirodhara, Chirovasti, Piji chill, symptomatic relief can be observed after that. Or from which all oils and extra, Kheerwala tel, Tung Drumadi tel, Himsagar tel, Bala tel, so many oils are there for mental diseases. And if we want to use rasayan, Lasun rasayan, Chitrak rasayan, Amalki rasayan, Medya rasayan, Manduk Parni, Asti Madhu, Guru Chi, Sang Puspi. So it means all of the viewers must have confidence on Ayurveda and discuss these things with their doctors, consult Ayurvedic physician, and then start taking these medicine. In Shaman Chikitsa, Smriti Sagar Ras is there, Siddha Magaradhwaj Ras is there, Manasamrit Vatakam is there, Brahmi Vati, Saraswata Rishta. These are common medicine. So, Alzheimer, communication, never argue, instead agree. Never reason, instead divert. Never shame, instead distract. Never lecture, instead reassure. Never say remember, instead reminisce. Never say I told you, instead repeat, regroup. Never say you can't, instead do what they can. Never command, demand, instead ask or model. Never condense, instead encourage. Never force, instead reinforce. Now I would like to request Avtar sir for his guidance on treatment.
Yeah, all the you told these things they are great. They are perfect for the stage 1 only. When they reach stage 2, 3, or especially 3 or 4, then is that time, as I told you, these 5 things, we have to make the all medication when they reach in our system, they should reach to the liver. If the gut is not good, they go through the colon out, not reach to the liver properly. Agnacia, they should have to work properly. They have to be reach to the liver until liver is not accept anything, not reach to liver. Blood can't be purified. That's my system. What I am doing, what I'm saying, what I found. Oh, make the your gut first strong, as I told you before. When you give these things, very good. All are, as I told in the beginning, every Ayurveda Acharya know what is the medication. They all written, they all learn that one. But I'm telling the which policy you apply on this one. First, check it. If the gut problem, no gut problem, then is these can start working. If they have the gut problem, any kind of, most of them Alzheimer patient, they have either they have some constipation, either they have some diarrhea, too much. They make that gut strong. As soon as you make the gut strong, gut and brain are related. Some bacteria go to reach to the brain. They also make the toxin there. And when you make the, if you don't want to on other cleansing, what I'm doing, what I design, they still work all the treatment, but you have to make the blood purify. Only I found in my research, if blood is purified, they can more take the toxin out from the body. Doesn't matter anywhere. They start that plaque cleaning. As soon as plaques start cleaning, take maybe 1 or 2 months, depend on the what kind of the treatment you chosen. If they choosing the right treatment, they definitely give the result within 1 or 2 months. This is not one-day job, but dementia people working whole life. You have to tell the patient, okay, this is not the painkiller to take it and relieve it. This is the take little long, but at least 1 or 2 months, they have to keep the patients, okay, to start that one. Give definitely any blood purify. All these you told me. I recommend one thing more. Doesn't matter any blood you can give the any blood purify you think is suitable for that body. We have so many blood purify things like Amal Kirsan also do the blood purify, also help to the liver, also help to the gut, and not too much pitta. You can work that one on all three dosha. Mahasudarshan Ghanabati, you can use it, that one, for the blood purify. If you give the very strong medication, maybe patients that time immunity is not very good, they not work on that. Let the start in the mild medication, 1 or 2, 3 weeks. As soon as they accept that, start working that system, start cleansing that system, then you start strong medication. Brahmi Bhatti, other Ghrith, if the digestive system is okay, go ahead that one. If the digestion not okay, then you have to very mild medication to give them. But detoxification is very important. Doesn't matter panchkarma, doesn't matter any kriya, doesn't matter any mild detoxification, definitely start working. Not take very long time. You have to be continuously and hold their diet. If you stop their in the diet, definitely I have to mention something. Stop giving any sugar, any sweet things. Stop giving too much dairy products. Give them, leave it on the kadas, that can help them more. If you can choose the any kind of the small kada, which one you can choose, depend on the vata pitta kapha, okay, and that one you give to the patient, that start also cleansing and blood purifying, that one. And then that's all that plaque until not removed from the brain, there's no chance to dementia can reverse, Alzheimer can reverse. These are my advice. These what things I used in my treatments, and I got the good result.
I would like to invite any question if there क्वेश्चन कोई भी पूछना चाहे, स्वागत है. हमारे साथ अवतार सिंह सर हैं. Yes, Dr. Venkat Reddy, would you like to say anything? Venkat Reddy ji.
Sir, namaskar.
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 I'm Dr. Venkat Reddy, MD Naturopathy, Ayurvedic medicinal research scientist from Hyderabad.
Ji, sir, namaskar.
Actually, nowadays we are observing the more Alzheimer's and the dementia and Parkinson's. Is that the can you improve blood circulation in head? Is there any particular medicine for that and exercises?
Your reception was not very good. Can you repeat again, please?
Actually, nowadays, after 60, after close to 55 plus, people are exposed to the vertigo, Parkinson's, or Alzheimer's.
Alzheimer.
Yes. Is there any particular exercises or medicine to improve the same?
These are the name of the diseases, but what is the stage of that one, Dr. Venkat? Very
No,
important
actually,
as Dr. Sharma mentioned, you need to be check up what kind of stage, what kind of disease, what kind of reason you got patient got these kind of disease. If they
okay.
you have to look after the full history, then definitely they are. Parkinson is very old disease. They're very clearly written in the Ayurveda things very in the beginning, so they can definitely reversible, but depend on the what stage they gone. Maybe take the long time. If the stage 1
Okay.
or 2, they can within 1 or 2 months you definitely get started reversing, start getting benefit from that one. But need to be full details.
Okay. 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 Thank you. Thank you.
Thank you, sir.
Yeah. Yeah.
Hari Om. Any question from anybody? Avatar sir, in your opinion, tea is nectar or poison?
Tea. What kind of tea you looking?
Our next webinar is on tea.
Okay.
Today is International Tea Day.
Okay.
So
what kind of tea? What kind of tea is you looking? There's so many type of tea, you know. There's the herbal tea, other tea.
No, tea means tea अपनी अंग्रेजों वाली tea.
अंग्रेजों वाली दूध पत्ती वाली.
दूध पत्ती वाली, असम वाली.
If they under the limit, nothing is wrong.
Right, you are.
If more than limit, tea is also herb, no? If tea 1 or twice is okay, and limited this one, is same like a chili.
Like you are
Chili
right.
is herbs that way. Chili is beneficial for the body.
जी
Nothing
सर.
wrong.
निशान जी कुछ क्वेश्चन पूछना चाहते हैं सर. निशान जी पूछिए.
कोई भी है पूछिए.
आपने काफी सारे पेशेंट अल्जाइमर्स के देखे होंगे. अल्जाइमर्स की शुरुआत यूजुअली जो क्लिनिकल सिम्टम्स होते हैं उससे 10 से 15 साल 20 साल पहले इसकी शुरुआत हो जाती है.
बिल्कुल हो जाए.
प्रोड्रोमेटा फेज या फिर प्री क्लिनिकल फेज कहते हैं, जहां पर बिनाइन फॉरगेटफुलनेस के अलावा और कोई सिम्टम्स नहीं मिलते हैं. इंडिया में तो इसकी अवेयरनेस काफी कम है, वेस्टर्न वर्ल्ड में इसकी अवेयरनेस ज्यादा है. तो आप उन पेशेंट्स को किस प्रकार से इस चीज को समझाते हैं, ये में जो मुझे आपका प्रैक्टिकल एक्सपीरियंस जो रहा हो, क्योंकि ये हर एक इंडिविजुअल को अलग तरीके से हमें समझाना पड़ता है कि ये बिनाइन फॉरगेटफुलनेस है, पर ये आगे जाकर के अल्जाइमर में चेंज हो सकता है. तो आप उस चीज को पेशेंट को किस प्रकार से समझाते हैं? अगर उस चीज को थोड़ा शेयर कर सकें तो ये उपयोगी होगा क्लिनिशियंस के लिए.
बहुत शुक्रिया आपका. Dr. Nishant, as you told, reach to the Alzheimer, definitely depend on the how severe case that one, how bad the health problem, how bad the dementia, the Alzheimer, diabetes or blood pressure and other medication he taking. Maybe the big head injury, they come within 2 months, that Alzheimer 3 months. This depend on the what kind of circumstances, what kind of the people suffer from that one. But always I say anybody ask, I recommend that one. If you start, everyone know what is their brain capacity, number one.
Yes.
Everyone understand, because the whole life they're doing. If their family have the Alzheimer or dementia, they should be careful more than other people. When their little sign come, anything missing, doctor, I can't, no need to say again. Dr. Pawan Sharma already mentioned the symptom of that one. When they start those symptoms, already person are on their stage, the plaque is built up in their mind, brain. So mean that time they should very careful from the diet, very careful from they definitely do I say the exercise, some kind of I made one exercise, I can add on that one, that's worked very well, and everybody can do it. We actually, lot of pollution at the moment, that is also a big reason to people getting more dementia and more Alzheimer. How can we clean our lungs? That's the reason brain get less oxygen, because our lungs are also toxified now. They not mention that one, but what I found, they have to be clean the lungs every day, at least 5 minutes. And that Kapalbhati is best thing. But I do that Kapalbhati, close the completely, hold the breath, not take any breath inside. Once they take inside, then they only throw through the nose. That one is work very well on the heart paper patient, the lungs patient. That one, this kind of that means from the body, all the bad toxin in the lungs throughout, because all the lungs will have all the moisture. That one, carbon dioxide should be go out. What we taking all the time, we not seeing that one. If you take it out, that one, that time maybe they help to the brain again. Brain get more oxygen, pure oxygen. Then these kind of things I recommend to them to do it, even not to them, everybody, all my patient, anyone, I say do this exercise, take carbon dioxide out of body. When you go to sleep, get up in the morning, or even you can do that exercise when you are driving, when you are walking, and that is the best. I found that exercise to take the maximum carbon dioxide from the body out. Then you can save your brain, save your lungs, save your heart. This is the I tell them. But any sign they're not sorting out after even this one, that's mean they have to see any professional and do their blood checkup, do their MRI scan if they go to very severe. Okay, and oxygen level, you can check it now with the machine. What is the oxygen level to your body? And control your the blood pressure. If they have that, nowadays nearly 30% people are, 40% are diabetic, pre-diabetic. So they have to be controlled. In India is the biggest diabetic in the world at the moment. First is America, second is India. So
Yes,
we have to look after that one. Most of them diabetic people very quickly can get the dementia and Alzheimer.
yes, sir. What you said is Kapalabhati is doing excellent, sir. Nowadays, many diseases cured with this Kapalabhati. I'm the yoga trainer. I'm doing excellent service.
Oh, that's good. Yeah, Kapalbhati, if you are yoga, I can put on in this group that one. What
Yes, sir.
I made the very light Kapalbhati.
Yes, sir.
And any condition of the I use actually made for the one of my patient have the lung scar and lungs collapse from the body. Completely, they have a lot of scar in the lungs, and I designed for him to strengthen the lungs. Then I realized this is working on the every kind of disease.
Exactly. Yeah.
And that is experience 1 year ago. I teaching him that the patient, I teach how to do it. I can share that video. Every patient now they're using, and they get very quickly oxygen in our body. When oxygen enough our body, every organ start working help to any organ. Okay.
Yes, sir. Yes, sir. Yes.
I definitely share on this group. Okay. And after this program, and you can pick up from there, use on your patient. Anybody, any age, they can do it. Any condition of the patient, they definitely 9% they can do it. That is take the carbon dioxide from our lungs out. Any pollution people, any normal patient, no need patient, any person, if they do that one, they can save their life at least something from the pollution.
Exactly, sir. This is a very interactive section, sir. Very useful for us, immediately.
And no, you welcome, sir. You welcome. I'm always ready to what my experience with the other patient. To be our good aim should be to give the good treatment to the every Bharatiya, everywhere world in the people living for what Ayurveda we have to tell them. This is we can do very easy, not difficult, nothing have the problem.
Yes, sir. It's a wonder what nowadays you are giving good. I'm doing research on Ayurveda. Wonderful formulation with us, sir. Giving 100% results after Corona. People are tuned to use the Ayurveda. Most of the people.
Yeah, Ayurveda is a beauty of Ayurveda is you don't have the side effects.
Exactly. Exactly.
Beauty of the Ayurveda, they not damage the other organ.
Yes, sir.
Beauty of Ayurveda is very easy to take it.
Can I tell you 2 minutes? Can I talk to you 2 minutes?
Yes, sir.
Actually, just now I received
our time is over. You can talk directly on AVTAR sir's phone or email ID.
Thank you, sir. Thank you, sir.
Yeah. Our time is over. 9 minutes over, because we are conducting webinar for 1 hour and 3 webinars daily. 905 webinar in 365 days recently.
Thank you, sir.
So please discuss directly, not on the platform.
And today you are coming in the London too, Pavanji?
Not today, sir. Oh, sorry. Yes, sir. Virtually.
Dr. Honsi send me you that one. I done the program on their site. Okay, and yeah.
At 11:30 India time, sir.
Yeah, I know, 7 o'clock in the evening.
Not 7 o'clock in the evening.
You better you come here, stay in England, okay?
Yes, sir, my India is much better than your West Bengal. England is like West Bengal for me. West Bengal has 8 crore population, and our India huge variation is there. I love my India.
No, when you want to do the program, come here, okay? Then don't have to be very late to wake up here.
Thank you, sir. So please stay with us, sir, because next session is also unique on tea, whether tea is slow poison or nectar. So two experts will guide us. Dr. Aruna Tilak ji is here. Professor Madam Parul Joshi ji is here. Both of them will be guiding us on the tea. Whether everybody, because I have not taken tea from last 45 years.
Oh.
In age of 15 years, I have left the tea due to variation in text. Very variated taste is there. Bitter, sweet, elaichi.
Like this is there's so many herbal teas. I